Good evening, my name is Amanda Warden and I'm doing my presentation on terbutaline. A little background information on the patient is a 26-year-old female who is 30 weeks pregnant. She's a gravida 1, para 0, who presented to the labor room with rule out preterm labor. She was having some uterine contractions that were picking up about every 3 to 5 minutes on a regular set schedule and becoming painful. She presented to the labor room and stayed in triage as an observation patient and received terbutaline 0.25 milligrams IM times 3 doses. You can give the dose IM every 15 to 30 minutes as needed for contractions. It proved effective for her to last for about an hour and a half before contractions would pick back up, and so she received 3 doses about 2 hours apart each time. So after that, it was decided that she could go home with terbutaline by mouth for a 72-hour span to control her contractions, and she would have strict follow-up with her doctor while she was taking this. So I'm going to go ahead and start now. So, Ms. Smith, it seems that the terbutaline that we've given you in your arm that has helped to stop your contractions and slow them down. The doctor wants to send you home to take that and to keep your contractions under control so that you don't have any more contractions. You're going to have to take the medicine. The way he prescribed it is you're going to take 5 milligrams by mouth every 6 hours. So you can set an alarm on your phone. It's important that you don't miss a dose because then your contractions could start back up. You're going to follow up with your doctor at the end of, it's only a 3-day dose, a 3-day course. So you'll take, starting tomorrow morning at 6 a.m., you'll take your first dose, and then at noon, and then at 6 p.m., and then midnight, and so forth for 3 days. And we'll make you a follow-up appointment to follow up with your doctor to see if it is still needed. With this, it's important that you don't double dose. If you miss a dose, if you forget that you take it, or you don't need to take more than you're prescribed. You take it as we do for you. This medicine can make your heart rate go up. It can make you have an increased heart rate. So what I'm going to need you to do is check your heart rate before you take it. And if it's greater than 120, don't take it and call your doctor. To check your heart rate, you can find, check it in your wrist. And if you look at your wrist, you have on the inside, on your thumb side, you can feel right here with these 2 fingers. Don't use your thumb because a lot of times you can feel the pulse from your thumb, from this hand, this pulse. So put your 2 fingers right here on the inside, right here, and you can count. You can feel the pulse. When you can feel it, have you a clock and count. You need to count for 30 seconds at minimum. And if that number at 30 seconds is greater than 60, then you need to, to be concerned. Actually, and if you see that it's greater than 60, if you check it for 30 seconds, go ahead and start over and check for a full minute. If you get anything greater than 120, don't take the medicine. Don't take it and call your doctor's office for further instructions. Can you show me that, how you would check your pulse for me? Great. Right, and if you have trouble feeling, the pulse or whatnot, you can try either arm, it's fine. Just it's very important that if your heart rate is above 120, that you notify your doctor and hold your dose until he tells you any further instructions. Let's see, and we need to make sure that you're not taking any other medicines that are similar to this kind of medicine. This medicine acts on your smooth muscle, which your uterus, where the baby is, your womb, is a smooth muscle. This medicine relaxes it, helps it to stop contracting. So it can, other medicines that can do that are some certain beta blockers or adrenergic agonists, which is a fancy word for pretty much a beta blocker. Any kind of blood pressure medicine? Are you on any kind of blood pressure medicine or anything at home? No? Great. Another thing is, if it's going to make you kind of short of breath, you're going to feel short of breath, especially if your heart rate is kind of fast. So if you start noticing that you can't catch your breath, you're short of breath, you just can't catch your breath at all, it's just really hard for you to breathe, you need to also notify your doctor as soon as, like, immediately, so that you can get that fixed, because that can lead to a serious side effect called pulmonary edema, which makes fluid back up in your lungs. It makes it really hard to breathe. It can also make your blood sugar go up. So I see you don't have a history of diabetes or any kind of blood sugar problems. So you may need to, if you start noticing maybe you're getting a little lethargic, or you notice a fruity smell on your breath, that's going to be something that you need to follow up with your doctor about, or call him immediately that day. That's a lot of what the problem is. You can't take this medicine for longer than about 72 hours because it makes your heart rate so fast. It makes your heart beat so fast that it can make your heart tire out. So after 72 hours, you will follow up with your doctor, and we will see if there's other medicines we can put you on should labor start or contractions return. Always, please contact immediately if any contractions start back or if labor starts while you're still taking this medicine. We don't want that. The goal of this medicine is to keep your baby in for 10 more weeks at least. Do you have any questions about this? No, and I see that you don't have any allergies that you know of, and all you take are a prenatal vitamin and a folic acid supplement. Okay, drink plenty of fluids, and just remember to always check your heart rate before you take this medicine, and notify your doctor if you notice a fruity smell on your breath, if you can't catch your breath, you're short of breath, and don't double dose. Take it every 6 hours. I would set an alarm on your phone for the times that you want to take it. And that's it. We will get this appointment set up for you with your doctor and notify you before you get ready to go home. Do you have any questions? Can you explain to me how you need to take it and why it's important for you to check your heart rate? Perfect. Perfect. Very good. If you have any other questions, please let me know. And I'll be back in just a second to get your stuff ready. Thank you.